And how people are doing that. Let's speak now to Professor Somadoda Figeni to just get a sense of what would have led the president to this. Obviously, he's had consultations, advice, and from the very start, Professor Figeni, President Cyril Ramaphosa pointing to aftertears, saying that there are a problem. We spoke to a doctor in the Eastern Cape from the FIA and Cecilia Makiwana hospitals saying that the number of admissions that are COVID-19 or as a result of COVID-19 have been from funerals. We've been told this from the beginning. Why are people not complying?
Well, I do think that after some time, people start believing that this has gone away, especially in the initial stages. Some people were saying that when the weather is warmer, you are likely going to have this virus vanishing. And also when the weather is warm, it's the time of ceremonies and festivities, some of which had been postponed from the earlier period of the year. So that is one of the reasons why you start seeing many people going back into some of these large gatherings. And also just the fatigue of following the rules. And that is the combination of factors that has brought us back to where we are now.
And I wonder about strategic communications and streamlined communications. The president speaking about the number of excess deaths earlier on, saying that number has increased. You'd remember that earlier on in the year, that figure was put at 62,000 excess deaths across South Africa. But yet there was a difference of opinion between medics on what would be behind this. The Medical Research Council, for instance, they were saying that this could be as a result of lack of access to medical facilities and treatment, and another medic saying, no, that there's a strong possibility that they're directly linked to COVID-19. Could that be part of the problem, mixed messaging?
Well, I do think that the mixed messaging is also because this is an uncharted terrain in many ways. That's why not only in South Africa, but throughout the world, you've seen the shifting of message around this particular virus, because new information has been coming, and therefore the communication could not have been consistent. Of course, more ought to have been done. Even when there was a shift in communication, there was a new information.
And the fact that the president also spoke about the number of deaths, you're saying there are still people out there who still don't believe that they can contract the coronavirus. How important is that to drive the message home and the kind of tailoring of messages? Because another thing that was mentioned was alcohol-related incidents or cases. This is the festive season when people typically get reckless. How do we drive the message home that even though it's only Nelson Mandela Bay that's been declared a hotspot now, that could happen to your area, any district right now, if people continue with their behavior?
Well, I do think that the most important thing is to recognize the fact that this problem is so complex and bigger than government doing it alone. Government can coordinate these responses, but when it starts from a family to a community, from a church to a school, and every one of us playing their part, then there is a possibility of containing the spread of this virus, especially the spiking of the second phase. And that in itself is very important. But if we say we wait for government, and government will tell us what to do, then we are likely going to have challenges, because government cannot be everywhere and anywhere, especially during the festive season. It is in the confines of our homes. It is in the verandas. It is in the spaces that we decide to let loose, that you are likely going to have the spread of the virus, especially in a country that has so much migration between the cities and rural areas and the cities and other cities.
So how can there be better support and coordination at national and subnational levels to coordinate protection of not only vulnerable groups. President speaking earlier on about how, for instance, initiation schools will be allowed to operate in the Eastern Cape because the traditional leaders forum has put together an alert level adjusted plan. So there is a concerted effort. So how do we see this at various subnational levels, greater cooperation and coordination?
The most important thing is just to reflect and say why, even when there was no COVID, you had some of the deaths in the initiation schools, and begin to say there might just be an issue here in terms of capacity, in terms of coordination. That's why municipalities and traditional authorities, law enforcement authorities ought to work very closely. But a targeted approach like the one being adopted, which says where you have a hotspot like the Nelson Mandela Bay, then concentrate your resources there and even bring some of them from across the nation to those areas. But the other areas that need special attention, even if they are not hotspots now, are the holiday destinations, especially in the coastal region, where you are likely going to have floods of people coming into those places. And of course, places which are feeders of the urban areas where people return back to their own communities in the Eastern Cape, in Limpopo, Northwest, in places like Mpumalanga, where you have major migration patterns. Then you have to track those and even be sure that you coordinate education and restrictions along the way.
So how are we going to do that? The management of that now, are we going to, obviously there's going to be greater law enforcement deployment because typically there is looking out for drunken drivers or people who transgress traffic laws, but how should this then be better managed? People haven't seen their families for a long time. The president saying, please don't tire of following the public safety rules, especially the non-pharmaceutical interventions. People forget. Sometimes it happens unwittingly, but we need people who are going to be there as reminders. We're going to do it with public education service in mind as well.
That is where now you appeal to the civil society, to the NGOs, and to the people on the ground to say, take charge and lead in this particular process. And campaigns should always be there all the time, because if you leave it to law enforcement, you leave it to government, sometimes they can't penetrate some of the spaces in our homes, in our parks, in our communities. They can't be everywhere all the time. Government, therefore, should be working with people, civil society, NGOs, and that in itself would begin to yield some results. And this messaging should also be done in various indigenous languages, because in the main, you find that pamphlets, billboard messages tend to be in English or Afrikaans.
And just in terms of Nelson Mandela Bay itself, what needs should be at the forefront when they, in tandem, try to bring the numbers down, but also not increase the burden on people who've already experienced this very tough period, very tough situation. It's been dispiriting for a lot of people, jobs lost, family members lost.
Well, I do think that the concentrated approach should also come with a relief for some of the workers who are in those areas by recycling the workers, make sure that they do rest, because doing routine work at times, people get tired and they start being more relaxed. And you can bring reinforcement from across the country. In some instances, extreme measures, you can even bring in the army, not now as law enforcement alone, but there are medics and many others in a support role.
All right, thank you very much, Professor Somadoda Figeni, political analyst. President announcing earlier on that Nelson Mandela Bay has now been pronounced as a hotspot area. It has seen greater restrictions, which start as of midnight today, dropping number 14th in the world, South Africa now, due to the rise in coronavirus cases. Francis?
Thanks, Sapisa. Let's continue to bring you some reaction now. To discuss, we're joined by the director of the Southern African Alcohol Policy Alliance in South Africa, Maurice Smithers. Mr. Smithers, your reaction to what was announced with regards to Nelson Mandela Bay.
Hello, Francis. Thanks very much. We think that it's good that some action is being taken, and clearly it is necessary to pay particular attention to places that are hotspot areas. However, we have been making a number of interventions suggesting that we also need to take preemptive actions, because we don't believe that it's appropriate to take measures only when you discover that somewhere is a hotspot area. We believe that we can, as we go into the festive season, there's going to be a dramatic increase in the amount of alcohol that is consumed. We're going to see a dramatic increase in the number of people on the road, and possibly people drinking and driving, and a lot of big parties. I know the president has said that there shouldn't be large gatherings, but we know that it's very difficult for people to avoid it around this particular time unless there are actual tight restrictions stopping them. And we also know that as soon as people drink a lot, they tend to let down their guard, and all the adherence to protocols goes out the window.
So what would you propose then?
Well, we think that there should be stronger measures across the whole country. For example, one of the things that could happen right now, particularly in anticipation of the Road Traffic Amendment Bill, which is currently before Parliament, and which proposes a reduction in the breath and blood alcohol content level of drivers, that they should announce right now a zero rating for those levels, so that everybody knows that drinking and driving just cannot mix at all, that there's no one or two drinks is okay because it won't take you over the level. It should be zero to protect everyone who's traveling on the road. There should be a banning of all special offers on alcohol, because if we're trying to encourage people to reduce their intake of alcohol and to drink in a safer way, why would we allow shops to offer people alcohol at incredibly cheap prices around this time? The same with advertising. Alcohol advertising at this time should be banned, because you don't want advertising to encourage people to drink.
Aren't you conflating a few issues here? Remember, the National Disaster Act is only about a targeted intervention for a specific goal. Here it is to save lives. Now you're talking about drinking and driving, advertising. I don't think there's a scientific connection, perhaps, between that and the amount of people who are going to succumb to COVID-19. And in any event, all the way along, people have been asking questions about this conflation. Remember that the initial goal was simply to prepare hospitals, to ensure that they are prepared for an influx. We couldn't stop the surge, and it's been months since March, so surely we should be prepared.
Well, Francis, there's two things around that. One is, in the Disaster Management Act, there's a specific clause, 2I, which says that government at national level, provincial level and local level have the power to control the sale and distribution of alcohol during a state of disaster. Now you have to ask yourself, why is that clause in there? Because this is not to do with COVID. This is in the Disaster Management Act. It's a clause that was put into the act when it was passed, 20 years ago. Why is that clause in there if it is not already known that alcohol poses a risk in a disaster environment?
Yeah.
Secondly, if you look at what's happening in Europe at the moment and in America, where there's a resurgence of the virus, the first thing that virtually every country does is it places controls, particularly on consumption outlets that sell alcohol, because it is known that alcohol is a super spreader. It is because people, once they've had a couple of drinks, their compliance just goes out the window.
So they have no responsibility anymore for their own actions?
I beg your pardon?
Are you saying they have no responsibility? You can't just blame the alcohol. People still have to take responsibility for their own actions.
Look, obviously everybody must do that. But the problem is that that's the argument that is used by the liquor industry. They say drink responsibly as though everybody's going to do it. The president has just stated in his speech, although he praised the country up to a point for adhering to the regulations, he has also pointed out that one of the reasons why there's a resurgence in the Eastern Cape is because people are not listening.
All right,
Mr. Smithers. People don't listen, unfortunately. So you need rules. You need tougher rules.
All right, thank you. We appreciate your view tonight. Maurice Smithers from the Southern African Alcohol Policy Alliance in South Africa. That's one view. I think we're about to get a very different view. Tsepiso.
Wendy Alberts joins us now to talk about the restaurant industry. A very good evening to you, and thank you so much for speaking to us. So, are you breathing a sigh of relief that the president has only for now spoken about restrictions in the Nelson Mandela Bay district?
Absolutely. I think that this is a massive sign for us to be looking at doing everything possible within the industry to ensure that the resurgence takes place. We need to certainly work with governments in making interventions that doesn't harm the economy, and most importantly, doesn't cause any dissemination to the restaurant industry that we've taken so much time to rebuild single-handedly without the support of government or any of the support from banks or any of the lending houses, landlords, and even the suppliers who's blacklisted many of our restaurants from obtaining credit to purchase necessary supply.
So, do you have restaurants in that areas that are associated to you, and had you had a conversation in light of the increase in cases of what measures can be taken to keep patrons safer? Obviously, there won't be any now, but just generally going forward, because we have to improve on our management of public health safety.
Absolutely. We've got a number of restaurants that are situated in that. And like I said earlier on today, within that belt, there's been absolutely no authority that has gone in and actually asked for any of the registers that we've had to diligently complete over time. And neither has any COVID authority been in to inform any one of our establishments that there may have been a case of COVID. So we've called for the scientific evidence to show that we are responsible for the spread of COVID. And within that area, we certainly will do a lot of communication. We'll be putting out an urgency this evening to be responsible, and that we need to exercise common sense. We need to avoid close contact. We need to avoid confined spaces, and we need to avoid crowded places at all costs. And the restaurants really need to adhere to the protocols within that area to show the responsibility in keeping patrons as well as our staff safe.
Monitoring and evaluation is something that has been put under the spotlight, especially for the hospitality industry, restaurants in particular. I've been to quite a number where there is absolutely no policing being done whatsoever. If you walk in with a mask in hand, it seems like that is sufficient, and we know that that is not enough.
Look, I think we've got to also be mature, and I think we need to understand as individuals. We need to do everything possible in our collective, in our industry, as well as our communities, as well as businesses, corporates, and government, that we need to start taking responsibility of ourselves. We need to start taking adult decisions, and we need to see if we want to be exposed into places where we feel we're at risk. The thing that was highlighted through this research that we've done is if we were a transmitter of COVID, patrons would not frequent our establishments. They would veer away. And we've got massive support from patrons. In fact, it is thanks to the patrons and the consumer that has given us the support that we've had to be in a position where we've been able to recover the industry. Because we've really been an island on our own out there, trying to find mechanisms and solutions and interventions to rebuild our industry alone.
I mean, fair enough, it's good to mention the individual responsibility we carry here, but I'm also talking about restaurants enforcing the rules, because these non-pharmaceutical interventions also include you as restaurant owners and managers to police. I've seen instances where people are very belligerent in being told that they have to wear their masks, they have to sanitize, but yet they bully their way through. So what I'm asking is, what are you doing? What responsibility will you take in such incidents?
We've encouraged our restaurateurs to use their right of admission. They're certainly in a position to be able to exercise that and to prohibit people from going to the establishment if they don't want to be compliant. So we are certainly seeing an increase in a number of restaurateurs forcing hand and ensuring that patrons understand how serious it is for them to be compliant. So
But
we've seen good.
how would you know that, and it's very interesting what you're saying, because this is what we were speaking about, excess deaths earlier on, that there is, disagreements on what accounts for it. But how do you know that somebody didn't get COVID from your restaurant? I may go to multiple places. Is it enough for the restaurants to say, but we're not responsible?
Absolutely. I think, nobody is a COVID expert. Nobody can advocate any form of responsibility. We're all responsible for the slowdown of the transmission, for being responsible, for practicing the protocols, the directives, and for doing what we need to do to slow down the curve. The most important element, what we are saying, is if COVID was in our restaurants over the last 3 months, the authorities should have informed us in order to do proper track and tracing, and most importantly, to have our staff tested, to do the isolation, and obviously to sanitize the establishment. And we haven't had any information from the authorities to inform us that our establishments have been contaminated any which way.
Right.
And neither have the restaurants ever been called for those registers which we so diligently put out. And I think we have to start looking at behavior, and we need to start talking about behavior. COVID is going to be along into 2021, and we cannot put further pressure on the economy. We can't even get payments out now for our staff on TERS and UIF. We're having a big fight with the Minister of Home Affairs in executing a foreign national payment because it's 9 months into the process of getting those payments out. So we've seen some payments coming through. But by closing down the restaurant industry, it's going to mean many further job losses, more impact on social behaviour and social behavioural issues.
I think what we'll take away from that, Wendy Albert, thank you very much, is that it really is a chain of responsibility. All sectors must be involved, all sectors must play their part, including individuals, in ensuring public safety. If you're not wearing your mask because you feel you are protected, the least you can do for me as a fellow citizen and human being is to protect me by wearing your mask.
Yeah.
Sanitize.
I agree.